coming winters, coming cough. Worried about whether it's a winter cough or a pneumonia? Well, here I am to clarify your doubts. A winter cough is usually seasonal, periodic, and allergic in nature. It is usually accompanied by upper respiratory tract infection, namely the nose, the throat, and the pharynx, while the pneumonia involves the lower respiratory tract and the lungs. The symptoms of upper respiratory tract infection, a winter cough, involves cough and mucoid sputum without fever. But pneumonia has high fever, cough, yellowish sputum, and sometimes the patient may cough blood. Always remember that in case you have these symptoms, always consult the nearest doctor possible at the earliest. So if you have these serious features of pneumonia, please consult the nearest doctor possible, an internal medicine or a pulmonologist. Thank you very much.